This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Nervend G Tablet is an effective solution for managing nerve pain. It combines gabapentin and methylcobalamin to alleviate discomfort and support nerve health. Indications and uses. This medication is primarily indicated for the management of neuropathic pain, which is often caused by nerve damage. It is beneficial for individuals experiencing pain due to various conditions, including diabetic neuropathy, and helps improve the overall quality of life by reducing discomfort and enhancing nerve function. How it works. The combination of gabapentin and methylcobalamin works together to interrupt pain signals traveling between damaged nerves and the brain while repairing nerve cells. Directions for use. Take this medication as prescribed by your healthcare provider. It should be swallowed whole with a glass of water, without crushing or chewing. The dosage and duration of treatment will be determined by your physician depending on factors such as age, body weight, and specific health conditions. It is important to adhere to the prescribed treatment plan and not to discontinue use abruptly without consulting your doctor. Possible side effects. Common side effects may include dizziness, drowsiness, nausea, and changes in mood. Should you experience any severe symptoms such as suicidal thoughts or allergic reactions, it is crucial to seek medical attention immediately. Precautions and warnings. Before taking this medication, inform your doctor of any pre-existing health conditions, particularly those related to the liver, kidneys, or heart. Pregnant or breastfeeding women should consult their healthcare provider about potential risks. Additionally, avoid operating heavy machinery or driving if you experience dizziness or drowsiness while on this medication. FAQs. 1. How long will it take for the medication to start working? It may begin to relieve pain within 2 to 4 weeks. 2. Can it manage diabetic neuropathy? Yes, it is effective for this condition. 3. Is it safe? Safety varies per patient. Consult your doctor for personalized advice. 4. Can it cause addiction? Yes, inform your doctor if you have a history of substance abuse. 5. What to do if I forget a dose? Take it as soon as you remember unless it's close to your next dose. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is appreciated.